Hello, welcome to the Health Center channel. Today, I'm discussing migraine with you. This is really important because migraine actually inflicts about 3.1 billion people the whole worldwide. That's about 40% of the world's population. And the WHO, or the World Health Organization, has actually termed migraine as a global burden. So what is migraine? It is a very bad form of headache that is usually located at one side, and the pain is throbbing or pulsating, and it's usually characterized with nausea and vomiting, photophobia or sensitivity to light, phonophobia or sensitivities to sound. For some people, few hours to few days before they get the migraine attacks, they detect some changes in them. It could be changes in their mood, craving for a particular food, or thirsty, excess urination. There are three classifications of migraine clinically. There is migraine with aura, migraine without aura, and then the silent migraine. So migraine with aura. Aura is just like warning signs or symptoms. So about few seconds up to about 2 days before some people experience the headache that is associated with migraine, they can experience changes in them. It's just like warning signs. It usually affects their sight. So people might see zigzag lines, flashy or spotty dots in their eyes, and some people might experience temporary blindness. For some, they could feel dizzy or numbness or tingling sensations such as feeling of pins and needles in some parts of their body, and then the headache comes. Then we have the migraine without the aura. That is when the headache just starts without any warning signs. But we also have the silent migraines. That is when people have all the aura, the warning signs, and then there is no headache at all. So, what are the treatments available for migraine? It is essential that people are properly diagnosed and get treated because headache can actually be disabling. So, for most people, migraine can be treated with simple analgesics and medication for stopping the nausea or vomiting. So, some simple painkillers that could be used are paracetamol, ibuprofen, aspirin, diclofenac, or naproxen. However, it is essential to note that if you have stomach ulcers, you couldn't take diclofenac or ibuprofen. And in kids, it is essential not to use diclofenac or ibuprofen. Antiemetic drugs or medications that can stop nausea and vomiting include methylcopramide and prochlorperazine. So if you use these two medications combined, hopefully it eases the symptoms. However, there are individuals that these medications do not work for. So we have the next line of medications known as the triptans. Triptans are specifically formulated to treat migraines and its associated symptoms. The common type of triptan is the somatriptan. There are other forms like the naratriptan, the elytriptan, the zoglitriptan, and the flavotriptan. It is prescribed by your doctor, or you could get some in the pharmacies. If you have been using the triptans and however you are not responding well to them or your symptoms are getting worse, you could be prescribed another form of medication. With triptans, it is not used in individuals with heart attack or stroke or even previous stroke. Now that takes us to the next type of medication known as the G-pants. So G-pants are generally formulated to prevent migraine and treat migraine. So there are some people who've got chronic migraines. That is, they have about 15 headaches days within a month, continuously for 3 months. That is classified as chronic. These ones can get G-pants from their doctors. For the G-pants, we have the Atto G-pants, which is usually used as a preventive medication for chronic migraine. and we have the rimegepant that can be used as a preventive medication and also treatment for migraines. Another form of treatment for migraine is the use of Botox. Botox injections are actually used for various treatments or various conditions, and one is preventing migraines. It is important to note that Botox for treating migraines is entirely different from Botox used in cosmetic purposes. So you would need a prescription or a referral to a specialist, a headache specialist, before you get this Botox. It is used in the NHS, so talk to your doctor and you might be referred. Now, when you go to see a specialist for the Botox, you get about 31 to 39 small injections all over your face. And the injection site is all over your forehead, above your ears, at the back of your head, and on your shoulders. This is to prevent migraine. However, the Botox effect weans off. Therefore, you have to get it every 12 weeks. For you to know that the Botox is working for you or not, you might need about 2 treatment sessions. After 2 treatment sessions, if it is not working for you at all, talk to your doctor because it is not for everyone. So these are the medication treatments available for migraine. Which of them have you used? At which point did you decide to use the other ones? Can you leave them in the comment section?